Hello, my name is Brett Regal. I am one of the students in the Accelerate Master's program at the University of Cincinnati College of Nursing. In my interview that I conducted with an advanced practice nurse, I had reached out to Rick Bauer, who is a CRNA at the University of Cincinnati Medical Center, who is also an independent contractor, so he is not attached to the College of Nursing nor to the University Medical Center alone. In regards to asking the questions, my first question was what was your area of advanced practice nursing, especially in the CRN role, and your background? Rick's response was, nurse anesthesia is my current occupation. However, I graduated with my BSN in 1994 and did almost 10 years in the ER ICU before going back to grad school. I completed my CRNA training in 2005. Interesting enough, when I had asked Rick to tell me more about the responsibilities and the role as an advanced practice nurse, especially as a CRNA, Rick's response was, my responsibility to the patient is very similar to what it was in my regular nursing career. You were still responsible for all the same things you were in the ICU or in the ER, but now the additional responsibility of anesthesia is added on top of that, not just restricted to anesthesia. At its most basic level, job is to make sure the patient remains unconscious, anesthetic, pain-free, hemodynamically stable, and have adequate muscle relaxation for whatever surgical procedure is underway. In addition to all this, there are times that I supervise nurse anesthesia students, SRNAs, at the University of Cincinnati College of Nursing. So my role in that regard is also to educate them in a manner in which they will remember while integrating didactic information from the classroom into the operating environment. When I asked Rick how much biostatistics he uses or how much it influences his professional practice or patient outcomes, Rick's response was, I try to use biostatistics as little as possible. This has been a personal viewpoint since undergrad. I will read research, but I do not do the research. Specifically with my profession, I know that a certain level anesthetic agent will provide an environment where 50% of patients would move when stimulated and 50% would not. If I increase that amount of anesthesia by 30%, then only 5% of those patients move and 95% remain motionless. Thus, formally, we can use repetitive similar patient scenarios and look at the past outcomes to guide future anesthetic management. While not formally researched, each practitioner has some flexible rules as they ascribe to when dealing with certain patient populations because of the experience they've had in their past. Overall, the interview with Rick was very enlightening. It was very open-minded to kind of see like the different drugs, the different like patient outcomes and the dosage and calculations they have to go into while just keeping a patient, stable during an operating procedure, even in a trauma situation. As a role of a CRNA, looks like a very stressful job. Looks like you have to pretty much keep up on your knowledge and make sure you keep your dosage calculations in the back of your head overall. But past that, I felt like it was, as shared, very mind-opening. So that was my interview. I hope that suffices.